physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
So, what could be causing your knock knees? This is for adults, and we're going to talk about how to fix it if you do have knock knees.
So technically, that would be genu-varus?
Valgus.
Valgus.
Yes.
Oh, that's right.
For the
going out.
professionals out there. So, when we're talking about knock knees, we're really talking about three circumstances. Number one, there's people who present with knock knees only when they're doing activities. Like
Okay.
I've seen volleyball players go like this. I see people when they squat, they start bringing the knees in. It's collapsing in. Basketball, you might see them jump with the knees going in.
Yep, landing and
Yep.
going up and down stairs. Sometimes people don't know it, but their knee translates inward and puts
Yep.
stress on the knee.
Then there's people who present with knock knees all the time, but it's due to tight muscles, weak muscles, or habit. Okay, those are the ones we can really help.
Sure, right.
Now, the people we can help are the people who have knock knees due to bony abnormalities or arthritis. Like if your arthritic joint starts to wear out, you see that quite often it might go this way or it might go bow-legged.
Sure.
There's nothing we can do about those.
A lot of times those people will walk and you'll see the knee kind of
Go
slam
in.
one way or the other. Or, the genetic or the, congenital things where you're
Right.
born that way.
You're born that the bones attach and you're actually knock-kneed.
Right.
You
It
can't
doesn't
help it.
matter how much you tighten or strengthen
Right.
the muscle. We're not going to change the bony formation.
Right, and you'll often see, like, if it's due to arthritis, after someone's had a knee replacement, they do straighten it out
Sure.
to some extent.
Right.
So,
right.
so frequently what is occurring to the knee, it's if you can think about three links, this is the weakest link: the knee, hip, and ankle.
So the joint above, the joint below, and then the knee.
So always look upstream and downstream. So if you knock knees with squatting, so what that means is quite often external rotators, the hip muscles that turn the hip out, may be weak. And so you have a tendency when you get down, especially under load, that your knees want to turn in. And that causes the femur to turn in and also makes you look like you're knock-kneed.
And then there's some implications to the ankle as well, which we'll talk about that in a little bit, right?
Yep. Yeah, well, we will talk about that. But the quadriceps may also be weak. So as you start to squat down, you're trying to recruit other muscles to try to help you, and that's often the hip adductors.
The ones inside, those
Yep.
groin muscles.
And also, yeah, as we talked about on the feet, if you got flat feet, your feet, can you see that, Mike? They're going to turn in like this.
Right here.
And see what that does to the knee right away? Yep, it causes it to go in like a knock.
What happens here is something's going to happen below.
Yep. So we got to straighten this. And if you have flat feet for a long time, the muscles on the outside actually get tight.
Right, because these muscles support the ankle and have direct implication of what's going on when the ankle goes flat or the foot goes flat.
So the first thing, if you have flat feet, you might want to get an arch support.
Mm-hmm.
You also don't want your shoes to wear out.
Ah,
Because if you see people who have shoes that have worn out, they're worn out on the inside,
Yep.
it makes it even worse. I mean, it plays into the knock knees.
or it may be the wrong shoe right off the shelf. It just does not have enough support on the medial or the inside. My mother just bought a pair of those, and she wore them for about 2 weeks, and I literally had to throw them out because they were breaking down. It just wasn't the right shoe for her.
Sure. So let's talk. We talked about a lot of things here, Brad. Let's first talk about, let's say your quads just aren't strong enough. And so what's happening is you're actually recruiting the hip adductors. So one way to squat without using the hip adductors is to actually do narrow base squats. So you can actually just do some narrow base squats like this. Yeah, it's better to do it like a ball on the wall.
Sure.
Brad, do you want to do that? And
Yeah.
keep the knees together.
Yeah. And balance is obviously an issue if you have some balance issues.
Right.
But doing it this way is really nice because
Yeah,
you can.
it supports you.
Yeah. And I'm going to not let my knees touch. I'm going to keep a gap in there and monitor that, and then go down and up. The ball really gives some nice support depending on your level of strength.
Now this is really quad Pacific.
Yes.
It's really it's virtually impossible to recruit the hip adductors when you're doing this. Now you could take a goblet and do goblet squats. You
I
could
got to drink something.
Yeah, yeah.
You mean the
kettlebell.
The kettlebell?
Yep.
Yep. Or, if you have some dumbbells holding
Right.
in your hand. Sure.
And add some weight to it.
The other option you can have if you don't have that is simply you can do one leg at a time when you
Sure.
get stronger, and that really is aggressive. Or, you can touch with one and focus on that one thigh and then do the other.
Now, if your hips are turning in because they're tight and they can't turn out like they should,
Mm-hmm.
Brad has the opposite problem. His hips don't turn in very well, but he's got a kind of a genetic predisposition.
I'm very comfortable like this, but this way they just don't
Right.
go.
So there's a lot of people that are tight, they can't bring it in very easy. So we're actually going to stretch it out. So all you do is a figure 4 stretch like this. Very simple to do. When you're sitting in a chair, you just put the ankle across the other opposite knee and give it a little push down, a little pressure, pressure on.
And this one's very functional, especially people as they get older. You always have to get your foot up to tie your shoe, put your socks on, those things. So what I do is when I put my socks on or my shoe, I always give this a few stretches and then go on with it. And actually do it laying down too. And
So it may be weird to think that by stretching the hip, it's going to help the knock knees, but it is, because no longer will your hips internally rotate, and that causes the knees to go in.
Mm-hmm.
So that's a good one to do. The third one is clam shells. I'm going to go ahead and do this.
Love the clam shells.
So very simple to do too. You can do this in bed, or you can do it on the floor. You're just going to line up your legs together. I got my knees over knees, and my hips over hips, my ankles over ankles, and I'm going to go ahead and do clam shells.
So he's just doing one hip right now, just the top one.
How you doing? I'm doing fine.
Yes, it looks like it really easy, but when you do them nice and slow like this, you'll be amazed. If you haven't done it before, you're going to feel that hip get tired after 10 to 15.
You'll want to start with no weight or no resistance, and then you can move towards a band.
Yep.
They have the thin bands. We like these thicker bands because they really fit. They don't roll up on the thigh very.
They're just so much more comfortable. If you ever used one of the latex or rubber bands and then you use these, I'd be very surprised if you would want to go back, because these are so much more comfortable.
These are nice.
They do what they're supposed to do.
And this is a lot more work. Oh my gosh. And
all you need to do is
move it up further, and it'll be easier to do. But I'm a beast, so I want to make it hard.
Yes. But they make different color bands too.
Right.
Some are easier, some are more difficult.
And of course, Bob and Brad name is on there, Brad.
Well, it's because we like them so much.
Yep. So now we can also go to, let's say that you're having knock knees all the time, not just with squats. You're going to do some of the same things.
Sure.
And we'll go over those again. But right now, one of the first things you should do is, if our knees are knock-kneed all the time, don't stand with your knees hyperextended. So you should have your knees should be slightly bent. Can you see that, Brad, or not?
There.
Yeah.
You can see right here. Let's strip you down a little bit.
Make it simple.
Show a little leg bob.
Here we go.
Yeah, it's going to make them probably turn the video off.
Yeah.
But some will stick around. So now go ahead and lock it out.
Okay. Now, if you lock the knee, it makes the knee look like it's knock-kneed, or externally, or it could also be varus too.
Going out the other way.
Yeah, but either way, you don't want to lock your knees. It's not good for them. And if it does make it look like it knock-kneed, this will help.
Right.
If you keep it slightly.
Yeah, knock-kneed or bow-legged, I think is what we're looking for if you look at the
there we
slang
go.
term.
Yep. So again, we're going to do the figure 4 stretch. Again, we're going to do the clam shells. Where's my Mouse.
Mouse. We need the mouse.
We did all those things already. We don't need to repeat them, Brad. Now, the other thing that I should try is actually you could foam roll
Oh.
or take a massager to the outside calf. Because again, if you're flat-footed, over time, these muscles tighten up. Can you see what happens here? My foot turns in because it's tight.
Flattens out right in here.
Now this muscle is not being stretched. It's shortened up. And over time, this actually gets tight. And that'll play into causing your foot to be flat. So you can use a foam roller. Brad, you want to do that? And I'll show a massager.
So we're going to go on the side. It's a little awkward. It's not too bad, though. But you can get on there. If you want to get more pressure, you
Does
go
yours
like
bother
this.
you, by the way?
Pardon?
I've been stretching mine, and mine have really got tight. So when I do this, and I use a really aggressive foam roller, I feel it.
Sure.
So
You don't have to have pain with all your exercises. It's up to you.
well, actually, you might want to have some pain with foam rolling.
But I mean, you don't have to be screaming and yelling in pain. But yeah, work it as tolerated.
This is where the massage gun works really nice, Brad. I hit this to my lateral calves every morning.
Yeah, this is also plays in if you happen to have foot pain on the side of your foot. It's possible it's due to these muscles.
Now you're going to stay off the bone. I don't want to hit right on the fibula there, but you can tell where that is.
Yeah. If you go with that different head, this has got the soft head.
Yeah, that you could actually go to the bone.
Then it doesn't hurt, but that would be a little uncomfortable on the bone. It doesn't do any good to go on the bone.
These just pop off.
Yeah, look at that.
Pops on.
Nice interference fit.
All right, but this, I can go over a bone, and it's not great, but it doesn't bother me.
Right.
Don't let your shoes wear out, like we talked about. If you're flat-footed, you want to make sure you replace them before they get.
Right. You go to figure out what kind of shoe. It's called a motion control shoe, are typically what you want for good support. They have a real thick sole, and they have much more support. They do cost more too, however.
Now, the last thing you can actually, I know this kind of is opposite of what we recommended earlier, but you can actually do sumo squats too. So sumo squats are bringing your knees way out, and that's working on trying to externally rotate your legs.
Well, I feel extremely comfortable.
Yeah, you're doing that.
This is right. Makes me feel good. Yeah, I'm very comfortable, but that's just me.
You have to put a little weight on to be a sumo wrestler, Brad.
Yeah, I know. I'm going to work on that. Don't worry. That'll be the fun part of working out.
All right. A couple 100 pounds you need to put on. So, all right. Thanks for watching.
Be careful with those knees.